So this is just a very quick overview of CREDO, so Clinical Research During Outbreaks workshop. That's a picture of Oxford, which is not always that sunny. So I'll just briefly go through, what is CREDO, why have we done it, how are we going to deliver the curriculum, and what's the target audience. So what is CREDO? So it's a training curriculum. The overall aim is to strengthen capacities of research teams in low and middle income countries that are vulnerable to epidemics, to generate the clinical evidence we need both to improve patient care but also control the outbreaks in those countries. It's a joint partnership between WHO TDR and the University of Oxford and the International Severe Acute Respiratory and Emerging Infection Consortium, which is a consortium of clinical research networks working around the world on epidemic infections, and at the moment it's about 50 different clinical research networks across the whole world working together, and that consortium is coordinated out of Oxford. And it's a theory and task-based training curriculum where we will give some information through PowerPoints. There'll be some online learning, but also some practical training. The overall learning objectives really is to describe the steps in planning and implementing a research study. Now, many of you already have a lot of experience, so forgive us if there's some repetition, but we need to make sure everyone is at the same stage. And it's a mixed group, so we have team-based groups from the institution, so there'll be a mixture of skill bases. So some of you in the teams will have a better understanding than others of different parts of the curriculum. We want to explain really how an outbreak influences your approach to designing a study, because our experience is that you have to take a slightly modified approach. I've been working on epidemic infections for about 15 years, and it does need some special adaptations really, so you can accelerate the research. And at the end, the objective is that you can develop a research plan quickly to run either an observational or a clinical study for an epidemic or an outbreak disease. So why was it developed? Well, it was developed really after our attempts to set up clinical research studies in Ebola. And this article really was outlining some of the challenges, the daunting ethical and practical challenges of trying to set up clinical research during the Ebola epidemic, which the Ebola epidemic was very special. It was very different, and most outbreaks are not that serious or that widespread, but it did raise some particular issues that we've been trying to address, and this curriculum is a way to try and share those lessons. And particularly, at the bottom there, clinical research on epidemic infections can often only be done during an epidemic, so you really have a short time window to do the research. You can't do clinical research on Ebola unless there's an Ebola outbreak, so you really have to be prepared for that. The idea came out of a meeting we had at the Wellcome Trust in London at the end of 2015 when we were looking at best ways to generate evidence for infectious diseases with epidemic potential. And it was a suggestion of that expert group that we should develop a training curriculum to try and distill the lessons we'd learned and try and use it to increase capacities in different countries. It's now been sort of formalised as an objective. So after the Ebola outbreak, there has been a lot of meetings and a lot of initiatives, but one of the key ones from WHO is the R&D, the Research and Development Blueprint for Action to Prevent Epidemics, which is a whole program of research to try and prevent another outbreak like Ebola. And one of the objectives down there on the right is supporting expansion of capacity to implement adequate study design. So it's embedded as an element of the WHO R&D program. This rather sort of complex picture shows the different elements, which it's in the document which is available online. But again, one of the key elements of this is supporting the response and local capacity and study designs, which is why that we're delivering this in collaboration with WHO because it's part of their program. So how will it be delivered? It's blended learning is the correct terminology. So it was face-to-face workshops and also self-directed web-based learning. So we're beginning with a 2-day face-to-face workshop today, and then there'll be 10 or possibly 9 web-based modules that you'll be asked to complete over time. Each module will take approximately 4 hours, but they'll vary, and there'll be tools for assessment built into the online modules, and then we'll finish with a second face-to-face workshop where we'll consolidate the online training, and there'll be a final exercise at the end, a sort of an outbreak scenario where you'll be asked to prepare a protocol. We are in discussion with the African Academy of Sciences of getting the curriculum accredited by them as an accredited program. The target audience is you. So it's multidisciplinary teams. We didn't want to just focus on clinical trial managers. We wanted to, or clinicians, we wanted to focus on the whole research team, so that the medical doctors, the research nurses, the data managers, so everyone has an understanding of how they would interact with each other to do a study under these conditions. And you all completed some data, and this is just the mix of people, which is great. We've got. And just to show that Africa is actually one of the regions that's at most risk of outbreaks. This is the most recent alerts on Health Mapper, showing quite a number of outbreaks in Africa over the recent months. And as you know, there's currently Lassa outbreaks occurring in West Africa, and lots of problems. There's a WHO list of priority pathogens that may cause outbreaks and for which we need to do research and development. This is one of them. Who's going to take a guess at which one that is? The red shows the endemic area for this disease. Yes, so that's Lassa. That's the geographic distribution of Lassa, but it may well go further east. Actually, it's not been well characterised. It's based on assumptions about the animal reservoir that may not be correct. This one? Sorry? No. Although it would be a similar distribution. That's actually Crimean Congo hemorrhagic fever. And this one. Ebola, yeah. So this is a new map which maps both the ecological distribution of the virus in animals, but also the susceptibility based on population density and health infrastructure. And the pink areas show the greatest risk of a big outbreak. So it's not just that the animal reservoir's there, but also there's a lot of people close to the animals and a weaker healthcare infrastructure. And this map could have been done 6 years ago, and you would see the big pink spot over there in the left. We might have guessed actually that there was a risk in Sierra Leone, Guinea and Liberia, but unfortunately this map was done after the fact. Okay, so that's what we're doing. So the objectives for the 2 days, well, we also want to know what your objectives are. So, in discussions we'll be asking you what you want to get out of the training curriculum. So we make sure that we meet your aspirations. Our overall goal is to influence your thinking and practice. My experience is that a lot of people shy away from doing research on outbreak diseases because they think it's too difficult and they've got other things to do. But if we don't do it, no one's going to do it. So that's really our purpose, is that when there's an outbreak starting, you think, well, I can do this. Let's get stuck in and try and improve the patient care and the public health response. The actual objectives, we want to get the teams together to get to know each other, to deliver the first part of the curriculum, and also importantly to learn from you. So this is the first delivery of the workshop. It's very much a pilot, so we'll be seeking your opinions on which bits were good, which bits were less good, which bits we can change, etc. Because it will only improve with your input. Okay, that's the introduction.